While universal access to contraception and family planning is a very complicated and controversial issue, it is a necessary topic to broach. The UN has defined access to family planning and contraception as a fundamental human right, something necessary to attain the Millennium Development Goal of eliminating poverty by 2015. However, focusing primarily on the human rights aspect of it does nothing to convince the white, middle-aged men who are in charge of policymaking. If it did, we would have already seen a significant decrease in population growth and poverty. We need to speak their language if we want to make a change, and that language is money. The U.S. alone gives approximately $50 billion a year in aid to impoverished nations, which is used for medicine, supplies, and food, but it's little more than a band-aid. This money does nothing to educate and put the power in these people's hands of manifesting their own destiny. What's desperately needed is policy change and how these funds are structured and handed out. If we spend more time and resources on teaching, it would end up saving us money in the long run. We don't need more aid money, we just need to use what we have more wisely. According to the European Parliamentary Forum on Population and Development, reducing unplanned births and family size would save on public sector spending for health, water, sanitation, and social services, and reduce pressure on scarce natural resources, making social and economic development goals easier to achieve. So when the Guttmacher Institute estimates that it would cost an approximately $3.6 billion a year to meet unmet family planning needs, which in turn is directly linked with reducing the poverty rate, it's not something to roll eyes at, as it will ultimately be returned to us many times over. Family planning in this case would include contraception and sexual education. Access to contraception has been proven time and time again to put the power of childbearing in the woman's hands and her hands only. If she has the power to decide how many children she will ultimately have and when to have them, when she is financially ready, it results in less mouths to feed from unintended pregnancies and more opportunities for her to pursue an education. This allows that woman to effectively lift herself and her family completely out of poverty, thus reducing the financial need for aid, and will ultimately save money. In the following slides, we will be discussing barriers that stand in the way of women receiving reproductive care, including abortions, and the different organizations that work to increase access to this much-needed care.
In order to improve women's reproductive health in Latin American countries, the development of a safe, effective, and culturally accepted method of birth control will be necessary. However, these improvements cannot be implemented if cultural and religious barriers aren't identified and taken into account. For our project, we're going to address the barriers to contraception as well as provide information that can lead to breakthroughs in order to improve sexual education. But what are some of the main barriers for the use of contraceptives? Number one is lack of knowledge and education. Even though there is an awareness of contraceptive methods, Latin American women have limited knowledge of the proper use, such as the misperception on when to take the pill and the proper sequence. Number two is inaccessibility to health services. This is partly because of the distance to health centers and also because of fear and embarrassment. Women perceive that contraception services are only directed towards married women. In Latin America, there is a strong social disapproval of premarital sex and pregnancy. Number three is religion opposition. There is a huge influence by the Catholic Church in Latin America. In most Latin American countries, the Catholic Church has been the predominant social driver of perceptions and mores. However, it is important to recognize the existence of many other religions that have an influence in the region. Nonetheless, there remains a strong opposition to contraceptives from the Catholic Church and other religions. Questions on what is considered an abortion are a persistent topic in the region. Number four is partners' opposition. Some women are pressured by their partner to not use contraceptives to prove the female's fertility. And number five is lack of access to service. According to a reproductive health analysis conducted by Guttmacher Institute in 2004, young women have the poorest households were likely to report a missed birth, to be practicing contraception, to use maternal health services, and to know how to prevent sexual transmission of HIV. Economic autonomy and social enrollment, as well as exposure to the mass media, are less common in these households. In an interview with Maria del Pilar Gámez, a Latin American woman that grew up and lived most of her life in Colombia. She stated that many of these barriers to contraception dictated how she made her decisions about her reproductive health. According to Maria, there was not a sexual ed program while she was growing up. All the school offered a class called Behavior and Health that was only directed towards explaining the anatomy of the reproductive system of men and women. Also, abortion was a forbidden topic. If single, a woman was not allowed to have premarital sexual relations. Thus, young unmarried women were embarrassed to approach health centers for assistance. However, if married, abortion was seen as a sin that God would punish you for. Therefore, no one saw abortion as an option, nor could they consider any type of contraception, because that was categorized as abortion, hence seen by the church.
In addition to barriers in access to contraceptives and sexual education, globally, 19 million women are estimated to undergo unsafe abortions each year. These are women who are unmarried as well as married. Contrary to popular belief, over 50% of women seeking abortions are married or live in stable unions and already have several children. In Latin America alone, there are an estimated 3,700 unsafe abortions. 32 abortions occur per every 100 live births. And there are 29 abortions per every 1,000 women, ages 15 to 44. The overall goal of our social media project is to illustrate to women of the United States the lack of access to modern contraceptives that everyday Latin American women face, as well as to show that unmarried women and adolescents have little to no access to reproductive information. Lastly, the governmental restrictions placed on abortion create a taboo around any and all reproductive issues in a society, which can condemn the reputation of a woman who chooses to get an abortion. Women may be unaware that safe abortion services are legally available. Even under limited circumstances, they may lack the resources, time, or decision-making power to avail themselves of such services, for the services may be inadequate to meet demand. Other inhibiting factors are negative attitudes of healthcare providers. In some countries, the legalization of abortion laws has not been systematically followed by the availability of safe abortion services or elimination of unsafe abortion. For this project, we want to make it aware that we should lift the taboo on safe abortion and create an awareness of how much sexual education women need in Latin America. We can create a better life for all.
As a solution to the problem, many organizations have been focusing on breaking down these barriers by providing direct access to contraceptive methods and family planning services. Our goal is to increase knowledge of these organizations that put access to family planning in the hands of women. Prevalent in this fight for the right to sexual education and reproductive health are two organizations in Mexico that are focused on providing the tools to promote these rights for women and families. MexFam, the Mexican Foundation for Family Planning, was established in 1965. This organization is based in Mexico City, with branch offices in 28 Mexican states. It works in 3 key areas: sexual health for youth, including a 2-day local event called JOCA, with a frank discussion on sexual health that has led to a 25% decrease in unintended teen pregnancies. They also focus on sexual and reproductive health care to marginalized urban and rural areas. Community health, which enables providers the training equipment and supervision needed to provide these services. This trifold approach makes sexual reproductive health a natural part of growing up and promotes autonomy and personal responsibility. Another such organization is the IMSS, the Instituto Mexicano del Seguro Social. The Mexican Social Security Institute was established in 1943 and serves as Mexico's public health system, which employs thousands of health promoters. After nearly a decade, IMSS is able to provide universal health care, a popular health insurance, or Seguro Popular, which attends specifically to the open population and provides for the unemployed, self-employed, rural workers, or otherwise non-salaried informal workers of the economy. It currently covers 17 states and serves 2.5 million families in Mexico. To address the more remote locations, IMSS has 225 roaming health teams, which are comprised of a nurse and a community action promoter. They move in vans to help communities with less than 500 citizens, known as microregions. I recently interviewed an employee of the IMSS, Yolanda, who worked as a social worker for 10 years before moving to the States in 1999. While there, she worked in the family planning department of IMSS, which focused on reproductive services and sexual education. Yolanda and her team went house to house in rural areas of Zacatecas, Mexico, informing families in as little as an hour of the anatomy of the body and its reproductive functions. They offered contraceptive services such as condoms, birth control pills, as well as tubal ligations, sometimes taking the woman to perform the operation in that same day. In addition to contraceptive services, they offered physical exams and assisted individuals in setting family planning goals. Given these remote locations, sexual education was often out of reach for many of these women, some of which were married between the ages of 10 and 15. This was equally important because in some of these rural areas there are often only small clinics with one doctor and one nurse serving more than 2,000 people.
Despite the organizations that are working tirelessly to bring contraceptive access to everyone in Latin America, there are still a lot of barriers in place, and there is no easy solution to providing more services in Latin America. The financial obstacles are the easiest of all to overcome, but there are still barriers in the way of religious opposition, partner opposition, and lack of access and education due to socioeconomic standing. That being, the poor and more marginalized women receive even less access. What's needed is a shift in consciousness, and not just throw condoms at people and tell them to figure it out, but to sit down with them and fully educate them on what it means to make an active family planning goal, much like Yolanda was doing for many years with IMSS. So what can you do about it? Write letters to your policymakers. Speak their language. Let them know that the minimal cost of contraception to every woman in the world will reduce the amount of aid that is needed overall. Campaign for better access to contraception. Start a petition. Get the word out on the street. If you educate yourself on the pros and cons of the argument, you are a better informed citizen and can pass that knowledge on to your family and friends, who can then pass it on to theirs. Lastly, you can donate money to any of the numerous organizations that provide these very services, clinics that are set up in rural locations that are trying to make a difference one woman and family at a time. Thankfully, Mexico has just passed universal health care with focus on youth reproductive health, not just married women's health. But there are countless other countries out there who aren't so lucky. You don't have to wish you can do something. You can do something small that makes a big difference. Remember, these women are just like your mothers and sisters and aunts and cousins. They want to live life to the fullest and have the same economic and educational opportunities afforded to others. Their future should be put in their hands, just like you want your future to be in your hands.